Hello and welcome to the Achieve Optimum Health Summit, where we explore how to prevent and reverse chronic illness. I'm Angelina Kardash, your summit host. And today I have a pleasure to welcome a very special guest, Dr. Caldwell Esselstyn. He's a leading champion and pioneer researcher in the field of a plant-based diet. Some of you know Dr. Esselstyn from the Fork Over Knives documentary, where he was featured along with Dr. T. Colin Campbell. But for those who are new to his work, especially people who are watching us from the different country, let me share that Dr. Esselstyn presently directs the cardiovascular prevention and reversal program at the Cleveland Clinic Wellness Institute. He is a famous TED Talk speaker. He has published over 150 scientific publications. In his bestseller book, Prevent and Reverse Heart Disease, Dr. Esselstyn discusses the reversal of atherosclerosis in his heart disease patients as a result of following a low-fat, whole-food, plant-based diet. Welcome, Dr. Esselstyn. It's a great honor to have you as my guest.
Well, I'm honored to be with you, and you have to help me again pronounce your name correctly.
Angelina.
Yes, I can do that. Thank you, Angelina. Pleasure to be with you.
Wonderful. Today, I would like us to talk about your secrets to the prevention and reversal of the chronic diseases, including heart disease. And we all know that heart disease in our country is the leading cause of death, and now the chronic diseases can be prevented and reversed with a whole food plant-based diet. So we're going to talk about that. So please tell us about yourself, your background, and your journey to a plant-based diet, and how did you become a leader in a field?
Well, actually, my training was in general surgery. And when I went to medical school at Western Reserve University School of Medicine, and when I left the medical school, I took my postgraduate training in general surgery at the Cleveland Clinic. After that, I was a year in the Army at Fort Bragg in North Carolina, and the second year in the Army, I was a combat surgeon in Vietnam in 1967, 68. I joined the staff of the Cleveland Clinic in the Department of General Surgery in 1969. By 1970, when I was chairman of the Breast Cancer Task Force, I became increasingly disillusioned with the observation that no matter how many women I was operating on for breast cancer, I was doing absolutely nothing for the next unsuspecting victim, which led me to do a bit of a global research, and it was quite striking to see that there were a number of other cultures like Kenya where breast cancer rates were 30 and 40 times less frequent than the United States. And then when you look at Japan, in rural Japan in the 1950s, breast cancer was very infrequently identified. And yet as soon as the Japanese women migrate from Japan to the United States, by the second and third generation, they now begin to have the same rate of breast cancer as their Caucasian counterpart. And perhaps even more striking was cancer of the prostate, which in 1958, in the entire nation of Japan, how many autopsy-proven deaths were there from cancer of the prostate? 18, perhaps one of the most mind-boggling studies, figures that I've ever encountered. But by 1978, 20 years later, they were up to 137, which still pales in comparison to the 28,000 who will die this year in the United States from prostate cancer. Well, somewhere along the line, after this observation, it became clear to me there would be more bang for the buck if we could look at the leading killer of women and men in Western civilization, which is cardiovascular disease. Because in this global review, I was encountering multiple cultures where cardiovascular disease was virtually non-existent among those who were eating whole food, plant-based nutrition, essentially without oil. So it was really rather exciting to think that the ultimate dream would be if you could get women and men to eat in a way that would protect themselves from heart disease, they would also at the same time diminished the likelihood of their acquiring the common Western cancers of breast, prostate, colon, and maybe even pancreatic. So that's where it stood in about 1984, when it was apparent to me that this observation of an absence of heart disease in these other cultures was simply not enough, that I had to do a study. And before doing the study, it meant that I really ought to be eating this way myself. My father had his first heart attack at age 43. And so in April of 1984, my wife and I initiated our journey into plant-based nutrition. And my own cholesterol plummeted, and after several months, it was 155 milligrams per deciliter, which I was still unhappy with. And then I said, you know, I've really got to stop all the oil. So I stopped the oil, and then 2 months later, my total cholesterol was now 119. This is without any medication, just through diet alone. So I really thought we had a grasp on how to do this. And I went to the Department of Cardiology and asked for 24 patients, which was the most that I could handle and still carry out my surgical obligations. And I was fortunate in getting these 24 patients, but they were very, very ill with triple vessel coronary disease. There were several who had failed their first or second bypass operation. There were those who had actually failed their first or second angioplasty. There were others who were too sick for this procedure or had refused. And there were 5 who were told by their expert cardiologist they wouldn't live out the year. And those 5 made it all beyond 20 years. But my concern in initiating this was that the rock upon which this study would flounder would be lack of patient compliance. And I was not a trained psychologist. And it was a concern that the study would fail if the patients didn't comply. So the mantra that I decided to use for these patients was the same that I had learned years ago from a wonderful West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their physician or by their family. So I used that mantra, and for the first 5 years, I saw every one of the patients in my office every 2 weeks. We drew their cholesterol, checked their weight and their blood pressure, and I went over every morsel they ate. At the end of 5 years, I was more courageous, and I stretched it out to once a month. Most cardiologists will see their patients twice a year. And at the end of 10 years, they were now pretty well on autopilot. So I began now seeing them quarterly. And then at the end of 12 years, this now made it one of the longest studies, if not the longest study of its type in the medical literature, and it was time to write them up. And it was really quite striking that there were 6 of the original 24 that I knew. I mean, they were nice guys, but I knew within the first month or two that they just didn't get it. I mean, I never had an opportunity to go further with them because I had absolutely no money for this study. And so with my blessing, they were released from the study. Those 6 returned full-time to their expert cardiologist. The other 18 stayed with us through the whole 12 years. And of those 18, there were 17 of those 18 who really had no further cardiac events over the full 12 years. That's particularly interesting because the 18 that had stayed with us, I wanted to know in the 8 years prior to coming into our study, while they were in the hands of expert cardiologists, we charted how many episodes of worsening coronary artery disease they had experienced in the 8 years prior to coming into our study while in expert hands. They had 49 events among those 18 patients of worsening disease. However, as I mentioned, for the 12 years once they came into our study, 17 of those 18 had no further events, but one little sheep wandered from the flock. After 6 years, got into the lamb chops and the French fries and the glazed donuts and more angina, heart bypass, and now he's back with the flock, but proves the point that I'm trying to make with your listeners today. So that was really a very gratifying as a start, and that was how my interest in dealing with these patients and publishing our findings in the Journal of Family Practice in 1995.
So how is your approach to treating heart disease unique?
Well, I have great respect for the others who are in this movement who are treating patients similarly. We all have some nuances. We're a little bit different. I guess I can be accused of being a little bit more of a taskmaster because I hate failure. and it appears that we've got something that is an absolute winner. And that is that if you're going to have success in treating patients to halt and reverse their heart disease, I think it's so important to, first of all, give them respect. Because if you think that you're going to make a significant lifestyle change, speaking with somebody without their spouse or significant other in a 12 or 15-minute office visit, it's never going to happen. It just is not going to happen. What I mean by showing a patient respect, the only way I know to really do this is to give patients my time. So in the present format that we have at the Cleveland Clinic Wellness Institute where I work, we see patients who seek us out once a month, usually limited to no more than 12 or 14, in an intensive single day counseling seminar. And this single day counseling seminar is 6 hours long. We ask them to come with their spouse or significant other, so both parties can learn about these lifestyle changes, which are significant. And it is so important that these patients embrace the knowledge of how it is that they created their disease in the first place, and precisely how we want to empower them as the locus of control to halt and to reverse their disease. So I think it's important here. I want to talk a little bit about the basic science about how this disease is created, because I think it's so important that if people are going to reverse this disease, that they ought to start out by knowing how it's created. And I think all experts would agree that where this disease has its inception, its onset, its beginning, is when we progressively injure the life jacket and the guardian of our blood vessel, which happens to be that delicate innermost lining called the endothelium. Now, the endothelium manufactures a truly magic molecule of gas, nitric oxide, which is responsible for the salvation and protection of all of our blood vessels because of its unique functions, which include: 1, nitric oxide keeps all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number 2, nitric oxide will keep, or actually, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number 3, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, protect us from getting high blood pressure or hypertension. Number four. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing blockages or plaque. So literally, everybody on the planet Earth who has cardiovascular disease, whether it's from London, Berlin, Chicago, New York, or Reno, Nevada, if they have blockages and cardiovascular disease, it is because by now, in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into a train wreck that they no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news here is this. This is not a malignancy. This is a completely benign foodborne illness. And once you can get patients to never again pass through their lips a single morsel of food that is going to further impair an already train-wrecked endothelium, then the endothelium will recover and it will make enough nitric oxide so you can not only halt disease, but we often will see significant elements of disease reversal. Now, I'm going to take a deep breath for a minute, and when I let that phone ring. So what are the foods that every time they pass our lips, we injure the endothelial cells? They are, one, any drop of oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells. Also, as does anything with a mother or a face. Meat, fish, chicken, fowl, turkey, and eggs, and also anything that is dairy, milk, cream, butter, cheese, ice cream, yogurt, and sugary drinks, Diet Colas, Pepsi Cola, Coca-Cola, and I don't like sugary foods. Cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses and honey. I don't like avocado, nuts, cashew sauce, or peanut butter. And also, I like them to eliminate coffee with caffeine. Coffee with caffeine. Decaf, okay. Tea with caffeine, okay, but not coffee with caffeine. Now, what does that mean you're going to eat? You're going to eat all those whole grains for your cereal, bread, pasta, rolls, and bagels. 101 different types of legumes, lentils, and beans. All these marvelous red, yellow, green leafy vegetables, white potatoes, sweet potatoes, and some fruit. And there are wonderful recipes in our book, my book, my wife and my daughter, Neil Barnard, John McDougall, and others. There are plenty of wonderful recipes for this. And now, there's one other thing that we have added that I think is so important, just in the last, about the last 8 years. It's not in my book. And that is this, that if you can persuade a patient to think about shrinking their head to a size that they could crawl inside the artery and look at the blockage, they would see that the blockage is an absolute cauldron of oxidative inflammation. So we need antioxidants, but no, do not go down to the health food store and buy a jug of pills that's gonna be labeled antioxidant because it doesn't work and it's going to be harmful. Therefore, I need you to get your antioxidants from food. Fair enough. What food? Food that is high in what we call ORAC value. O-R-A-C, oxygen radical absorptive capacity. So this means that if you're having raspberries, blueberries, strawberries, and blackberries on your morning oat cereal, that's a terrific start. However, nothing can trump the antioxidant value of green leafy vegetables, which I need you to chew, not smoothies or juicing. I need you to chew a green leafy vegetable, roughly the size of 3/4 of your fist. I want that 6 times a day after it has first been boiled in water, so it's now nice and tender. And then you must anoint it with several drops of a delightful balsamic vinegar. Why? Because the acetic acid in the vinegar has been shown to restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich, again, that's 3, again at mid-afternoon, that's 4, dinner time 5, and of course I adore it when you have that evening snack of kale. What are you doing? All day long you are basking in that nasty oxidative cauldron of inflammation with nature's most powerful antioxidant. Now, there's a second benefit from chewing the greens. You restore the capacity of your bone marrow to once again make the endothelial progenitor cells. What are they? They replace our senescent, injured, worn out endothelial cells. Now, there's a third benefit. The third benefit is when you are chewing the green, you are chewing a nitrate. That is going to mix now with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate that you are chewing to a nitrite. Now, when you swallow the nitrite, your own gastric acid will reduce the nitrite to more nitric oxide, the very molecule that you are deficient in if you have heart disease. So when you think back on it now, here you are chewing the greens, no added expense, no hideous side effects, and they all this day long. Doing this, you are literally restoring the very molecule of nitric oxide, the deficiency of which has given you this disease in the first place. So that's the method that we use, and it's and from the publications we've had and the observations, we find it is to be extremely effective, very powerful, and it endures. Yeah, nitrates are the greens that you're chewing.
Right.
But a nitrate is sort of metabolically, as it were, inert. It has to be converted to a nitrite to be of benefit to make nitric oxide. That's why when you chew it, now there are other things that you have to do to be sure that that process develops. That is, you must not use mouthwash. If you use mouthwash, you destroy the bacteria and you can't have the conversion. And apparently, I've been told that it's possible that fluoride in toothpaste also will compromise that. And the other thing is, obviously, if you're on antibiotics, it destroys those beneficial bacteria. And the other thing that's important is to avoid taking antacids, because if you take an antacid, it elevates the pH, that is to say, it decreases the acidity that's naturally in your stomach. And if the acid isn't there, then it cannot reduce the nitrite to more nitric oxide.
So, but how then would you treat patients with the condition called GERD, basically, if they have acid reflux?
Well, I don't think that well, first of all, I'd let them have the knowledge of what you're doing and why it's important to not compromise the acidity. But my understanding with GERD is that this is when you have reflux of gastric acid up into your lower esophagus. Because if your gastroesophageal sphincter is not competent, then you could be in trouble. However, Remember this, and this is often forgotten and why you can possibly get many of these patients with GERD to get away from taking antacids, because water or liquid will not flow uphill. So during the daytime, when you are standing and sitting, your gastric acid is not refluxing up into your esophagus. However, where you really burn your esophagus, if you're one of these patients, is in the evening at night when you're laying flat in bed and you have an incompetent gastroesophageal sphincter, then gastric acid is going to roll up into that lower esophagus and burn it. However, my teaching was that if you can get these patients to have the head of their bed elevated by 6-inch blocks, now putting in an extra pillow or two doesn't do it, doesn't work. The entire bed has to be on a slant by 6-inch blocks at the head of the bed. Now your gastric acid cannot reflux up into your lower esophagus, and you probably can safely compromise and decrease some of the antacid if that's working properly as it should.
Got it. Let me ask you the next question. A lot of people believe that fats are very important to brain health. And what is your approach to that, since you advocate to avoid fats to reverse heart disease?
Well, first of all, I'm not aware of any diet that shows that you have to eat a high-fat diet to have brain function. As a matter of fact, I just look at our own family with 10 grandchildren, all who have done very well academically, and they're all plant-based. And I just don't think I have ever seen any good, hard scientific data to show that people who are eating a healthy diet of whole food plant-based nutrition are in any way intellectually compromised.
Got it. What is your take on a very popular low-carb, high-fat paleo and keto diets? And is there a role for a vegan keto diet? I heard about vegan keto diet as well.
Let me come back to further answer that other question first. But again, you mentioned that this is a low. This is not meant to be. Our diet is not meant to be a no-fat diet. As a matter of fact, we recognize the importance of the essential fatty acids, which are omega-6 and omega-3. And you'll never be short on omega-6 if you're eating this diet. If you're concerned about omega-3, be sure you're eating plenty of flaxseed meal, perhaps on your cereal, and also at every meal, some nice green leafy vegetables. And that should keep your omega-3 where it should be. You can always get a blood test to see if it's at the appropriate level. And you could always take some omega-3 algae as a supplement if you feel it ought to be higher. Now you asked about ketogenic. Yeah,
right.
It's not even worth talking about because there's no data. There's no data. Sure, you get a little bit of a minute lowering of blood sugar, or you can lose weight, but it's a tragedy. Just imagine asking people to eat meat and dairy. And those are the very foods that are going to make an initiation of cardiovascular disease and make it flourish. Where has there been a single study of patients seriously ill with heart disease where eating a ketogenic diet has shown that you can halt and reverse the disease? It's non-existent as far as I know. Ketogenic, paleo, and Atkins all thriving on meat and animal protein and dairy and meat. And there's research that's been out now really for a number of years from Stan Hazen from our own institute about TMAO. Now, TMA is trimethylamine. And it's been identified that people who are eating an omnivore diet, all right, the ketogenic diet,
right.
When you eat that diet, you contain in your gut, in your microbiome, bacteria that will metabolize the lecithin and carnitine that are found in these animal diets. Those molecules will be metabolized by this unique bacteria in the omnivore's gut into the molecule of TMA, which is rapidly oxidized by your liver to TMAO. And TMAO has been shown to injure blood vessels, which is another point. So therefore, if you're going to eat a diet that has meat and dairy in it, whether it's keto and paleo and Atkins, then you're putting yourself at further risk for the TMA molecule that will be there. Now, on the other hand, if you take patients who are strictly plant-based and feed them a lamb chop and then measure their blood for TMAO, it's not there. Why? Because persons who are totally plant-based do not have the bacteria in their gut to produce TMAO.
Let me ask you this question. I listened to your lectures and you frequently mention an epidemiologic study of the Norwegians during the World War II, which found a dramatic drop in heart and cardiovascular disease death while Norway was occupied by Germans. So can you explain why that happens, and do you believe that this could be attributed to Norwegians eating fewer animal foods that time?
Yeah, I mean, obviously it has all the pitfalls of an epidemiologic study like this, but it was really quite striking when you see what happens. It would be similar to what happened in the persons who were in the World War II in the German concentration camps. Heart disease was practically unknown. They were living on this vegetable gruel. In the Norway study, it was interesting that when the Germans occupied, apparently they took away their livestock, their cattle, their sheep, their goats, their pigs, their chickens, their turkeys. Where were they? They were for the Germans' troops. So these people now presumably were largely, not entirely, but largely thriving on whole food, plant-based nutrition. And if you look at the dramatic graph that is in that article by the Strom and Janssen, who were the authors of that study that was published in the Lancet in 1951. It was quite striking to see on this graph where in 1939, as soon as the German occupation took place, heart disease deaths and just began to suddenly plummet. And until 1945, when with the death of Adolf Hitler, there was the cessation of hostilities in the European theater. And immediately, as comes back the dairy and the meat, immediately, once again, the deaths from heart attack and stroke go back up to what they were pre-1939. Rather fascinating.
Interesting. I'd like us to go back to the basic, because many people, they're concerned about protein intake on a plant-based diet. So can you explain to my viewers, where do we get protein from, and would this diet be sufficient for athletes, and what supplementation do they need? I mean, do athletes need to take in addition protein shakes maybe, or protein bars?
Protein shakes and protein bars are absolutely, totally 100% unnecessary. Have you ever heard of somebody who went to an emergency room and said, my gosh, I've been totally whole food plant-based for the last 2 years. Am I protein deficient? No, it never happens. Why? There is all kinds of protein in grain, all kinds of protein in beans and legumes and lentils, all kinds of protein in vegetables, all kinds of protein in potatoes. Nobody can ever be deficient if they're eating a well-rounded whole food plant-based diet. That is total folly. And to take these artificial protein powders is a joke. The best thing is you stay away from food that has been processed and eat whole food plant-based nutrition. For instance, how many protein powders do you suppose the Okinawans are eating, or the rural Chinese, or those living in Central Africa? Do you think they're eating protein powders?
I don't think so.
I think so.
So those people that you've just mentioned, I mean, you know, based on your research, I mean, they basically, they lead a long life, right? And they consume, you know, primarily.
Well, the Okinawans, before they became Americanized, had more people who lived to be 100 than anywhere else on the planet.
Right. Um, Now I would like us to talk about your work. So most people are familiar with your work from the very popular documentary Forks Over Knives. And let me just tell for people who didn't see the documentary, but the movie makers follow the stories of several patients with serious heart diseases and metabolic disorders who sign up for your plant-based programs, right? And see dramatic improvement in their health over the course of several weeks. And it's definitely very compelling and persuasive. My question is, why don't we see many more clinical cases like this published in major medical journals so the other conventional medical doctors can employ whole food plant-based diet as a reliable treatment modality?
Well, I think it's an excellent point, and is frequently answered or frequently asked. Right now, perhaps some of the most sophisticated training in medicine is provided for the cardiovascular community, where they have to learn all these various drugs that they employ, and they have to learn about all these interventions like stents and bypass procedures and replacing valves and so forth. So there's an enormous amount, but very, very sadly, one thing that is not included in that education is education about the causation of the illness that they have been asked to treat. And I will share with you that 4 years ago, I was invited to become a member of the American College of Cardiology, which I have very willingly done. And I'm a member of the Nutrition Committee. And we have a very creative and energetic chairman of the committee who is completely committed to trying to have this committee be responsible for trying to educate the cardiovascular community about the causation of the illness that they've been asked to treat. And it is progressing. There are now nationally organizations like Plantrition and the American College of Lifestyle Medicine, where you have literally thousands of doctors who are committed to and not only the education of physicians about nutrition, but also care for their patients, with having a consideration of nutrition being a very paramount part of that education. Now, there also is another little wrinkle here in all of this, which, in all fairness, without pointing fingers, has to be mentioned, which is compensation. I mean, when you compare the compensation for doing a bypass operation for a patient or putting in stents, compare that to the remuneration maybe for talking about Brussels sprouts and broccoli, you would find that there's quite a difference. And so it's very, for some people, it may be a little bit more challenging to get interested in a decrease in compensation. For example, right now, there are three main reasons why this is not making much headway as it should. First, one of the major stumbling blocks we have is the United States government. If you were to look at the United States Department of Agriculture, it is now run by persons who formerly were the head of the Cattlemen's Association, the Dairy Association, the Pork Board, the Egg Board. These people are hugely conflicted. And so it's very hard for them to do otherwise. Every 5 years, they make up a plate of food for the public. And on that plate for food for the public will be the very foods that, if consumed, will guarantee that millions of Americans will continue to perish. So that's the government against us. Also, industry is against us. How much do you think the $30 billion statin drug industry is interested in having this epidemic go away? And then there are my own colleagues. How many surgeons are clamoring for fewer stents and fewer bypasses? So we do have some challenges ahead of us, but really the atmosphere is, and the way the pendulum is swinging now is so different than it was 35 years ago when I got started with this. So I have nothing but really optimism that that we could really see before us a seismic revolution in health. And when I'm talking about a seismic revolution in health, I'm not talking about whole food plant-based nutrition only taking care of and eliminating heart disease, which, by the way, would be a $40 trillion bonus for this country if we, according to the economists Coppell and Murphy, who wrote about this in the Chicago University Press. So we get out, not only do we get rid of heart disease, but you get rid of strokes, you get rid of diabetes, you get rid of hypertension, you get rid of vascular dementia, you get rid of Crohn's disease, you get rid of strokes, you get rid of rheumatoid arthritis, lupus, and multiple sclerosis, and allergies and asthma, and the list goes on. We have never before in medicine had such an absolute incredible tool in our toolbox. And so that really what it comes down to is that when we in the profession finally will have the will and the grit and the determination to share with the public and the profession what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them as the locus of control to absolutely annihilate chronic illness. Thank you.